I'm Dr. Robert LaDouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today I'm going to start my series on information for teenagers. And today's topic will be problems with your period as a teenager. So teenage years are a transitional time, and it's definitely common for teenagers to have issues with their periods. Irregular periods, significant amount of cramping, symptoms of PMS, heavy periods, and there are different interventions that we can do. So we're going to touch on that, but rest assured, it's very common to have some of these issues, and hopefully we can make them, give you some general education and information that'll help you towards the path of having a better experience. So periods can start normally as early as 8 years old, and also not occur until about 16 years old. So that's kind of the normal range, but the average is around 11, 12. But if you're having it sooner than 8, or if your child has it sooner than 8, that's some reason to notify your physician. And you still haven't had a period around 16, then that's when you'd want to contact your physician as well. There are some extremes that can affect when the period comes, like if you're very, very thin, especially if you're under 120 pounds, or if you're significantly overweight, that can affect when your period occurs. If you have a significant amount of discomfort, there's lots of over-the-counter preparations, brand names like Midol, starting with Tylenol is good. Advil, ibuprofen, those are non-steroidal anti-inflammatory drugs, often work a little bit better and often are helpful if you start them before the cramping gets bad. So if you take, for example, Aleve, when you know your period is just starting before the cramping gets bad, it can decrease the prostaglandins, the process that's causing the pain in the first place, and maybe even decrease bleeding a little bit. So that's an option available to you. Make sure you don't exceed the instructions. Some patients say, well, if a little is good, then a lot is better. Tylenol, non-steroidals, all of those in higher doses, exceeding what's on the label, can cause significant damage to your liver, to your throat, to your esophagus, to your kidneys, and they don't work any better if you exceed the dose. So be careful, watch those. Okay, so if you have a little bit of irregularity in your period, that will normalize as your weight as you get older and get into that more normal range. And if it's not a significant disturbance of your life, then you don't have to do anything about it. But if it is, then it's worth mentioning to your family, or if it's your child, it's time to visit with your doctor. There are things that can be done that to improve the regularity of periods, or to affect the mood swings that inevitably occur for some women around the time, premenstrual syndrome. One of the methods is hormone manipulation. The hormones, it's from the brain, they're a little less well developed, and so they're not as regular, and there are interventions that can be done to make them more regular. They're very safe and effective, but that's not something in detail that can be prescribed for you on a video. But just know that there is something available, or there are things that can be done, and you don't necessarily have to have any invasive physical exam to speak with your physician and get on a path to more predictable periods, or less discomfort, or less scary, unexpected episodes of bleeding that can interfere with your life. I'm going to share some other topics related to this. You can look at the other videos that I have that might be of use, like oral contraceptive pills. That's one of the hormone manipulations that can help with your periods. There's another video on dysmenorrhea, which is cramping with your periods, interventions for that. And there's a whole segment on sexually transmitted diseases. You want to be aware of that. If you're not sexually active, certainly that's not an issue. But once you decide to, that can certainly contribute to period problems as well. If you are sexually active, you should be considering that as well. So I hope you found these comments of use, and please leave comments of your own. Thank you.